Dr. Yusuf, thank you so very much for joining us for Trailblazers in Health series. I'd like to begin asking you, you know, talk about your interest in cardiovascular disease, and also give us insight about, your study that you did for South Asians.
Well, my interest in cardiovascular disease has been since 1976, since I did my doctorate in treatment of acute heart attack. It stemmed from many sources. I mean, I found cardiology a fascinating discipline, very logical. Also, at that time, there was a lot of opportunities to make advances. So at about that time, my father died from a heart attack, so that, I don't know whether that played a role, likely did, but I had made the choice of doing cardiology before he passed away. And as we know, there are many people in all our families who have cardiovascular disease at some stage in their lives.
Right.
So that sort of motivates you further. Now, over the years, I've been interested in finding ways to treat cardiovascular disease better or prevent cardiovascular disease. And my initial few years was in improving the treatment of acute heart attacks. And I was involved in either leading or helping lead major studies in the treatment of heart attacks, then in treating people with heart failure. But gradually my interest became greater in why South Asians purportedly developed more heart disease than other ethnic groups. And I got interested in that.
Yeah.
And we did a small study on that showed some findings which are interesting, just showed that the usual things that matter for non-South Asians mattered for South Asians. And these included smoking, elevated blood pressure, and diabetes, low income. And that then led to, in order to understand that better, to larger studies that involved many countries, many different ethnic groups. Then we did a similar study in people having a stroke. And then we said, in order to understand this better, we need to study people well before they get the heart attack or stroke.
Right.
So we set up a study called PURE, which is one of the largest studies in the world, being done in 27 countries, about 200,000 people.
Wow.
And we've got about 10 years or 11 years of follow-up at the moment. And that's shedding new light.
That's interesting to know. Now, given your lifelong experience in the cardiovascular disease, what is your take why it is not optimally managed or controlled in the South Asians?
Well, I think it's not optimally managed or controlled in people irrespective of ethnic groups. It's not just South Asians.
Not just South Asians. Okay.
And it's because I think we don't have good systems to deliver prevention in the community. We do not have good systems to deliver care either. By systems, I mean not a doctor prescribing things. You need a structure to ensure you pick up people with, say, high blood pressure in the community, that they're treated with combinations of drugs, not just one drug, that they're monitored. And this probably is better done by non-physicians, because you don't need a physician with very high levels of expertise to deal with that.
Right.
So that's just one example. There could be cholesterol or diabetes. So I think it's the lack of a systems approach to both prevention as well as treatment.
Also, make me understand that, what is the situation of South Asian immigrants, when they migrate to this country versus the natives, So let's say if somebody comes from India, hypothetically, had he lived in India, what could have been his cardiovascular health condition vis-a-vis when they migrate over here?
Well, it varies where they migrate from and where they migrate to.
Okay, that's interesting.
Heart disease rates and stroke rates also, remember both are important, varies across India. Some parts have high rates, some parts don't have as high rates. Second is which country they migrate to. And the third is what their socioeconomic background was before they migrated and what kind of socioeconomic background they have when they come here.
Right.
Okay. So the migrants from South Asia to the UK in particular, or to places like Trinidad and other places, initially were people who either worked in the fields or they worked in the factories. So they were less educated, lower socioeconomic classes. They tended to have higher risk of cardiovascular disease and mortality. And when they went to these countries, at least in the UK, although there was free healthcare, their knowledge of healthcare and the ability to access probably was not the same. And in Trinidad, I don't know whether they had free healthcare, but these things matter. People who came to Canada came in various waves. The old waves, which is about 100 years back, they've been now in Canada a long time, and they too came to work on the farms. Okay, but the more recent waves are people who are in technology, doctors, professors. That's a different socioeconomic class.
Right.
So I don't think we can equate what happens to the two different waves the same. The South Asians who came to the US were much more recent in the last 50 years or so. And it was a different group of people. It was a group of people who were more educated, and they came here and got into good jobs and eventually had incomes that are in the top whatever percent, maybe top 20% or top 10% of the US population. So the big driver of what happens to people is which socioeconomic class they are in, what their knowledge of the healthcare system is, and whether they access it and they use it right.
Yeah.
So I don't think there's a single answer to your question. It varies.
So make me understand that, the stressful environment that we all are living in, sometimes we tend to forget what our needs of our body are, The lifestyle for many individuals who have migrated to this part of the world has totally changed.
Yes.
And that's in all age groups. We see heart attacks happening in youngsters as well, as young as 30s and 40s, And what is it that you'd like to advise, how vigilant they should be of their health?
I mean, heart attacks or strokes in young people, let's use both words because strokes are just as important as heart attacks, and we don't talk about that, occurs in young people, in Asians, in India too. It's not just here.
Right.
In fact, it's even more in India.
Right.
The number one cause, I would say, is tobacco smoking. The other ones are elevated lipids, the bad lipids, LDL. And the third thing is high blood pressure. And if they have elevated diabetes, elevated blood glucose, which we call diabetes. These are four simple factors that are responsible for the majority of heart attacks and strokes. There are other factors too.
Right.
These four are. All of them are easily detected or treated and controlled. But that's where we have failed. The healthcare system has failed. People have failed. Now, you can avoid getting these risk factors. First, smoking is a personal decision.
Right.
Second is by keeping your weight down, exercising, eating right, moderate quantities, and more fruits and vegetables, less carbohydrates. Because South Asians consume one of the highest carbohydrate intakes in the world, and especially starchy carbohydrates, to reduce that. So more fruits and vegetables, less starchy carbs, and eating a modest amount of animal proteins, that is fish or meat, is not bad. It may even be good.
Oh, okay.
Yeah, I think in societies where they don't consume much meat or fish, actually consuming some is good.
Okay.
And societies where they consume a lot, consuming more is not good. So,
for the last 2 days that you've been here interacting with a lot of medical professionals, in your opinion, a conference like this, how helpful is it for raising the awareness of cardiovascular disease amongst the South Asians, and more particularly how in alliance they can work with other South Asian organizations?
I think a meeting like this is very important, and this meeting particularly was superb. First, most speakers have done their own work, but they are overlapping but different. So it's nice for somebody like me to hear what the others have done and what their thinking is. You don't get it from their publications, and by the time somebody publishes this, their data already 2 years old. So I get the latest information, but more importantly, by interacting with them, I can get the interpretation. The same thing goes for everybody. The second thing is this group of organizers in SKN are remarkable people with a great deal of social commitment, and they wanted to convey this to non-physicians, and so there was sessions that involved them, patient groups, provider groups, interacting with them, so that was good. I think it's the exchange of knowledge between experts, between the experts and I won't say non-expert, but the non-medical people helps, because medical people need to get the perspective of the non-medical people. So I think this is tremendous. It raises awareness. There's a dialogue, exchange of information.
I'll wrap up the conversation with last two questions. The second last question to you, of course, I want to understand about the advancements in the area of cardiovascular disease, and what more particularly South Asians, should be taking care of when it comes to healthy heart.
I think, and brains, always put both together. I think, South Asians in the US, North America, don't smoke as much as other groups. So that is good, but lower it further.
Right.
Get your blood pressure checked, and if it is elevated, make sure you get it treated and it's controlled. If your cholesterol is borderline or high, get treated for that. And if you've got diabetes, I think you anyway need to keep your blood pressure really well controlled and your lipids well controlled. These are 4 simple things you can do.
Right.
In addition to that, I would say be active. And I differentiate that from exercise, because being active means walk around at work, at home, to the car, to the grocery store. So do that. And obviously ensure your strengths by climbing upstairs. It's important to have strong legs. And so activity is important. And eat a balanced and variable diet. So a moderate amount of vegetables and fruits, a small amount of meat or fish is not going to kill you. It may even be helpful. Reduce the carbohydrates to whatever you eat. It shouldn't be more than a quarter of your plate. And if you're eating carbohydrates like rice or chapatis, you replace it with whole grain. It's like whole grain chapatis or naans or bread, or unrefined or unpolished rice, brown rice as we call it, but again, moderate amounts.
Also, can you talk about what does the future look like? Can you talk about the advancements in the area of cardiovascular disease?
Oh, we've made huge advancements in cardiovascular disease since the 1960s or 70s. And in many countries like the UK and even the US or Canada, cardiovascular mortality rates, once you correct for the age structure of the population, has declined by more than 50%. That is huge. So, and this is due to the understanding the risk factors. It's not necessarily fancy new drugs or genetics or anything. And smoking reduction is number 1. Second is controlling blood pressure and lipids by either diet, activity, or drugs like statins. These 3, I cannot emphasize to you how important they are. Now, once somebody gets heart disease, there have been many, many advances for the different kinds of heart disease, whether it's heart failure, whether it is arrhythmias, whatever. And there are newer and newer drugs coming. But to be honest with you, the biggest impact is going to be in implementing the 3 simple things: getting people to stop smoking, controlling blood pressure, controlling your lipids. That is from one point, risk factor perspective, and 2 other things, which is be active, be really active. I mean, you can be active in any way. 10,000 steps, 8,000 steps, that's good for you. Climbing a staircase, even one flight, as opposed to taking the elevators, and moderate diet, moderate amounts and moderate variety. I don't go for complete no carb or low carb or no fats or thing. I don't go for extreme reduction in salt. Avoid high salt, avoid high fats. I'm not saying avoid fats.
Right.
So I think it's a moderation, and it's something people can stick to.
Right.
So that would be my advice. And yes, there will be advances coming along, and every few years we have major advances or important advances. But our biggest advances that we need is implementing what we know. We know a lot. We don't implement it well enough.
Yeah, I think very, very aptly and beautifully you mentioned that we know enough, but we don't, are not using it optimally. Dr. Yusuf, thank you so much for your time. Hope you had a pleasant stay, and wish you great traveling back to Canada. Thank you so much for talking to us.
Well, thank you very much indeed.